Take it
Thank you
away.
so much. It's such a pleasure. Could you see the slides?
We are seeing them now. Yes.
Okay, great. So it's full screen, right? Giving the 7 to 10 minutes, I would highlight something I have been working on, both US, China. I think there's a great potential in the era of global aging, combined with the age of AI, and countries could work together, not only US, but many other countries. And we know there are three challenges to health policy in global aging and in the age of AI. Is first thing is we have concentrated healthcare costs, which is driven by the chronic conditions. Many people have multiple chronic conditions, and the majority of the healthcare spending are towards a small proportion of people with multiple conditions. But we would want to make things more smooth to intervene in early stage of chronic conditions when people have fewer, instead of when people have a larger number of those chronic conditions. So a life course approach, not only focusing on the disease episode, but also the life cycle of developing chronic conditions is very important to intervene. So later on, I will say something the US and China could work together, and they really learn from each other about, for example, I work on dementia. And in China and the US, the health insurance policy are both now reimbursing the screening and the diagnosing of cognitive impairment. And evidence from China shows that that really drive down the ER use, emergency room use, and reduce the tertiary hospitalization. And in America, Medicare Advantage now is taking more than half of the Medicare population, and some new healthcare policies about the risk adjustment is also trying to incentivize the doctors to promote them to screening people with higher risk. But we are still assessing evidence about how that affect healthcare spending and the cost. So I think both countries are working on this. And the second challenge is about healthcare is not about like building big hospitals. I think that's an issue for both countries. China, US, although in very different economic development stage, but very similarly, both countries are hospital centric. But a lot of those chronic conditions, as population aging, is not being tackled by the building hospitals because health issues are in daily life and is not being very effectively addressed by the physicians. So, for example, the economic conditions, pollution, stress, food systems, cities, and all those things affect how we can effectively tackle the chronic conditions as a result of population aging. Like in America, 1/5 of healthcare dollars are spent caring for people with diabetes. And in China, the prevalence rate is lower, but the growth rate for diabetes is very high. Potentially in the near future, China will spend even more on uncontrolled diabetes epidemic. So China this year launched something called National Obesity Campaign, trying to address some of the chronic conditions like diabetes, hypertension as a result of obesity issues. So both countries are faced with this challenge. And the third thing is we call the health in all sector. Because if we rely on only public health to address health issues, is far from enough. We need technology. Both countries and the countries in the world are faced with a shortage of understaffed nursing homes and the caring facilities and caring infrastructure. And as we see the inflation rate for different products over the last 20 years, you can see that the service price are surging. The mobile phones and all those electronic products are like the price are reducing. So care costs are very much surging, and both countries are using different policies to try to mitigate the care shortage. But as we know, the population, the fertility rate is lower, and population aging will get the care resources even less. And so robots caregiver have been like in more and more like care facilities in some very elite nursing homes in China. Now they try to adopt a robot as caregivers to talk to all the adults and to monitor their daily activities and doing those things. But Japan is more of a pioneer in that sector. So we see more and more studies from Japan and some initial studies from China to assess how robot caregivers can change or shift the burden of caregiving and how that affect the care quality of the caregivers. So as if we look at the American data here, overall the AI spending in this age now, age of AI, the third ranked the third is medical and healthcare sector, but it's on average in the last year it's about like 9.3 billion US dollars. But this is definitely an undercount because we see that AI infrastructure governance, data management, and autonomous mobiles vehicles are all like even financial technology. Some of the spendings and investment are actually indirectly towards medical and healthcare sector. So I think this is undercount, but still medical and healthcare are ranking the third in AI spending. And I only list the US data because in China it's not quite comparable because here only shows, here as I show that is private investment. If you look at the private investment in AI, China is very minimum, but China relies more on the public investment, especially from the government. And in the public health sector, as we see that the National Health Commission has the China's HHS has been issuing the reference guide for AI application scenarios in the health sector. They classify into four cases, and they invest heavily on those four cases. One is AI plus medical service management. It's more like hospital service, clinical services. And second is more about prevention, public health services, and all senior care. And the third is health industry development, which involve like the pharmaceutical R&D. And the fourth is medical education and research. So China's framework of highlighting and developing the AI technology in health sector is consistent with other major countries like here in the US. So there are several items that scenarios of AI technology being implemented to invest in the health sector, like health resources allocation, communication, public health surveillance, medical education, as I was mentioning, the VR, the virtual reality, augmented reality, those have been like used in the medical education, and even more the health system decision making. I will highlight some of our research recently, and lastly is the pharmaceutical R&D and long-term care. I will skip all this. So in terms of surveillance and public health interventions, China, US, you can see those. I just highlight three studies recently looking at using AI to optimize like COVID-19 clinical public health and vaccination rollout strategy, which is done in US. And some more recent studies published in Nature Medicine just a couple of weeks ago about vaccine chatbot interventions in Shanghai to promote people's uptake of HIV vaccinations. And our team here in the US, we try to develop a large language model for the government for info-surveillance or the surveillance of public health information like the mental disorders, misinformation, vaccine hesitancy, all those issues. We are building these large language models using like more than 20 major language in the human society and most of the major public media. So we collect data from there and have a timely prediction about things that could happen in terms of public health crisis. And this is like we use both the Chinese social media, American social media, and some other countries and try to develop this. And in terms of that's a lot even bigger use, the healthcare decision making. In America, even here at Yale Health, we already been using chatbot and in assisting the doctors to make decisions. In China, especially starting from early this year, you all know that the DeepSeek came into the China's hospital market. Before that, China was it's not quite as straightforward to access ChatGPT or Google Gemini to assist the doctor in decision making. But DeepSeek fundamentally changed this, and there's a JAMA article which assessed about hospital adapting the DeepSeek in Chinese hospitals by May 2025 this year, and already more than 800 hospitals are leveraging the DeepSeek in their healthcare consultation, and they are basically doing a systematic review of what functions they use in terms of DeepSeek. So one the most frequently used purpose is the report interpretation, which is followed by intelligent triage, assisted diagnose, medical record quality control, and also the clinical decision support. All those functions have been used to assist the doctors in their decision making. We recently published a number of papers assessing different large language models, some developed by Chinese enterprises, but some developed here like ChatGPT. Here in China, like DeepSeek R1, like the Wenxin Yi and chatbot. And we compare with the real doctors seeing the patients. And we use the setting in one city in China and in the primary care facility and some very common conditions like asthma. And doctors, we have followed the 4 checklists of standard patients and seeking care and see what the AI chatbot was asking the patients and what the physician are asking and how efficient they compare to each other and the proportion of correct diagnosis and the correct medications. We show some very surprising and findings here that the AI chatbot are much outperforming the real doctors, which may not be so surprised, right? Given that they are trained with the previous medical record and both in China and US. And we also find that the Chinese developed large language models are better at diagnosing and prescribing medications for infectious disease. But American developed large language models are better at diagnosing, prescribing for the chronic conditions, which may be based on different burden of disease in in different countries. But there are still some concerns. For example, there's a lack of budget constraint for the AI models. They may prescribe the good medications, but more pricey, and sometimes they overprescribe. So that's something we are working on, try to build a budget constraint for them and try to solve some of the ethical control. Although the AI chatbot may prescribe a larger proportion of correct medications, but sometimes some medications are wasteful, even harmful. How to deal with all those potential issues. That's something we published last year and this year. We're still doing pilot testing in the field. But what's quite interesting is the AI chatbot and the human doctors may ask a very different set of questions on the checklist, but they are very different in their efficiency. I think that leaves large room for the medical students to learn from AI chatbot, what they ask, why they are different from the AI chatbot, and how they can improve during their medical education to more efficiently, more effectively communicate with the patients. So that just to show some examples. And lastly, what we have been working on in Chinese setting and in Japanese setting, also a little bit in American setting, is try to assess some of the robots caregiving, how that's being affecting the caregiving quality and accessibility. And definitely there's a long list of benefits of using the AI as technology to care for people with lack of independence and who are disabled. But there's definitely a long list of challenges like technology adoption and improving accuracy, reliability, and how to integrate with existing health systems. Because the concern is when you integrate more data, you are having a larger data security risk. And also how to ensure how to combat the bias and ensure the equity of access and how to reduce costs. This is especially a problem in case like China because more than 90% of old adults are living in the community. So the robust caregiving is so pricey and unaffordable to each individual older adults. Unlike in American setting and other Western countries, more people living in institutions, which drives down the costs and access to those new smart health technologies. And eventually here we see, if we look at the data, the AI being used in the professional service robot sector, you see that the medical and healthcare is at the bottom. That means we are not as progressive proactive in investing in caring for all adults or those who are sick compared to we use service robots in the transportation and logistics and the hospitality agriculture sector. So there's a large room for to improve the trustworthy and affordability and accessibility of AI robots to care in the medical and healthcare setting. And lastly, I think this we already mentioned in the age of AI and the population aging, we have to promote from caring only the patients to the populations because a lot of diseases are out of the hospital. We have to address the social determinants, and AI provides such effective tools. And also, we develop more and more chronic conditions, and a lot of those risks are happening in early stage of life. How to start from early stage and pay attention to the life cycle of the disease progression. That's something AI can help. And also AI can empower the health for all in addition to the conventional public health sector. And lastly is global collaboration, also very important for promoting health for all. For example, just to give you an example, in Shanghai, starting from last year, China trying to build a dementia-friendly community. In Shanghai, they voluntarily screen older adults about their cognitive impairment, referring them to the clinics, institutions for better care. We link the assessment data with the medical claims data in Shanghai. We show that this dementia-friendly community really drives down the outpatient and inpatient care and reduce the chance of avoidable hospitalization or emergency room visit for China. And in America, we are now doing something similar. We try to assess different health insurance policies, how that affect people addressing the healthcare costs. For example, starting from 2011, Medicare has a policy called annual wellness visit. Starting from 2017, Medicare reimburse cognitive assessment and care planning. And after 2020, the Medicare Advantage start to increase the risk adjustment for dementia assessment, which promote doctors to assess more those patients. And recently, FDA also approved some new treatment for early stage Alzheimer's disease drugs. And those are very important for us to pay more and more attention to early stage of the disease development. And so I think although there's no direct collaboration for both countries in that way, but you see that China is implementing some policies in the community and US is trying to use Medicare policies to address of the lack of timely diagnosis. And both countries are working on this very important issues and very costly disease for human
Dr. Chen, Dr. Chen, my apologies. We're going to have to move on to our next speaker, but thank you so much.
Thank you. It's my pleasure.
Your slides are also available. So
yes.
With that, we need to move on to our next speaker.